country on our latest coronavirus test results, vaccination statistics, including our close to home mobile vaccination initiative, and other matters from the Ministry of Health. Following the minister, I'll reiterate key points regarding supervised quarantine for non-immunized travelers and other matters. We will also be joined tonight by the government's Chief Medical Officer, Dr. Board's Chief of Staff, Dr. Wesley Miller. First, we'll hear from the Minister of Health. Minister?
Good evening, everyone. I too would like to join in with the sentiments of condolences expressed by the Premier with respect to the recent deaths concerning the COVID virus. In particular, our prayers and condolences remain with the families, the friends, the loved ones, and the work colleagues. Our thoughts and prayers are with you all. The Ministry of Health received 1,155 test results since the last update, and one was positive for coronavirus, and this gives a test positivity rate of 0.1%. This new case is classified as under investigation, as it is a resident with no currently identified link to any other known cases or history of recent travel within the past 14 days. Additionally, since the last update, there were 12 recoveries. There are currently 196 active cases, of which 186 are under public health monitoring and 7 are in hospital with 2 in critical care. Since March 2020, Bermuda has recorded 2,462 total confirmed cases of COVID-19. Out of those, 2,234 persons have recovered and sadly 32 COVID-related deaths. The source of all cases is as follows. 298 are imported, 1,967 are classified as local transmission, of which 1,559 are local transmission with a known contact or source, and 408 are local transmission with an unknown contact or source, and 197 are under investigation. As investigations proceed, transmission categories may change. The 7-day average of our real-time reproduction number is 0.558. Fear of another death, I am encouraged by the news that more and more people are recovering. Our hospitalizations are down, and we have had fewer confirmed cases of the coronavirus. Our numbers are trending in the right direction. Let's all continue to be vigilant. If we continue to follow the rules, we will get to the safe place where we can return to more normal activities. I will now provide an update on the vaccination program. We have completed the 17th full week of vaccinations. From January 11th until May 8th, 2021, Bermuda has administered a total of 62,161 vaccinations, a figure that rises to 63,994 if you include vaccinations administered between Sunday, May 9th and Wednesday, May 12th as well. And again, this is very, very encouraging and excellent news. Of the 62,161 vaccinations administered for the period in which I'm reporting on, which ends on May 8th, 52% were women and 48% were men. Good progress continues to be made in vaccinating our population and especially our most vulnerable. In fact, 79% of all residents over the age of 65 have had at least one vaccination, and 67% of those persons are fully immunized. To date, 53% of our population has been vaccinated with 1 dose, and 44% of our population has been immunized, mainly having 2 doses. We are making excellent progress. However, time is running out. Bermuda's current supplies of Pfizer, BioNTech, and AstraZeneca vaccines expire on June. Therefore, the first doses of AstraZeneca will be administered until the 30th of June, with the second dose administered from a new batch of vaccines received from the COVAX facility. We have vaccines available in Bermuda for any People in our community who have said that they will Additionally, appointments at the college are also available from 11 a.m. until 1 o'clock p.m. And also the Bermuda Hospital Board's Vaccine Center is open daily between 8 a.m. and 8 p.m. for anyone with an appointment. We have also made it very easy to get vaccinated by going out into the community. There are mobile vaccination centers available 3 times a week in various locations around the island. On Sunday, May 16th, our close to home mobile vaccination program will be at the Victor Scott Primary School on Glebe Road from 10 a.m. until 2 o'clock p.m. Next week, our mobile vaccination program will be in the following locations. On Tuesday, the 18th of May, it will be at Pennell's Wharf in St. George's from 10 o'clock a.m. until 2 o'clock p.m. On Thursday, the 20th of May, it will be at Southampton Princess, again from 10 a.m. until 2 p.m. And on Saturday, the 23rd of May, at TCD in Hamilton from 10 a.m. until 2 p.m. These sites are for people who have not yet registered for the COVID-19 vaccine, do not have access to the internet, and prefer to register in person, or who may have additional questions about the COVID-19 vaccine. There will be doctors on site to answer any questions that you have, and you do not need an appointment. Just show up and roll up your sleeve. For those people who want to hear about the COVID-19 vaccine from a trusted source, again, we recommend the Close to Home program as an ideal opportunity to learn more. A minibus service is available to take people from their homes to the mobile vaccination sites and back to their homes afterwards. Anyone wanting to use the service should call the number 533-5903 between 10 a.m. and 1:30 p.m. As part of the ministry's outreach, we are very pleased to report that yesterday, a team from the Bermuda College Vaccination Center vaccinated 10 homebound people with the AstraZeneca COVID-19 vaccine in the west end of the island from Southampton to Paget. This was done in partnership with St. John's Ambulance, who kindly donated the use of their emergency response car. Thank you to St. John's Ambulance. The team plans to go out again this Saturday morning to vaccinate those who have requested home visits in the east end of the island from St. David's to Devonshire. Anyone who feels that they need a home visit for the COVID vaccine, please contact vaccine@gov.bm and the team will arrange a visit in the next coming weeks. As many people will know, the Food and Drug Administration and Health Canada have both approved the Pfizer vaccine for children ages 12 to 15 years old. Parents are encouraged to register their child who are appropriately at this age on gov.bm so that the Ministry of Health can appropriately gauge interest in those persons wishing to have their children, again between the ages of 12 and 15, vaccinated. As a memorandum of understanding between the Bermuda government and the Foreign Commonwealth and Development Office specifies that the vaccine can be used on youth ages 16 to 18, we are working on a resolution of this before we can begin to administer the vaccine on that age group. Also, there have been questions regarding the AstraZeneca vaccine administered to persons under the age of 30. The Chief Medical Officer is available for technical questions on this, but the Bermuda Advisory Committee on Immunizations has approved the use of this vaccine on that younger age group, taking into consideration the incidence of adverse effects and the availability of alternatives. As a reminder, we are in phase 2 of our roadmap to reopening, and to progress to phase 3 on June 6th, the onus is on each and every one of us. We have to be extremely careful, follow all of the guidelines, and keep ourselves and each other safe. Now is not the time to start wearing your mask, stop physically distancing, and mixing households unnecessarily. That is how this virus has an opportunity to spread, and we've seen in recent months how quickly it does spread. It is essential that everyone wear a mask in all indoor settings and outdoors if you cannot maintain physical distance. Your mask should completely cover your nose and mouth. The nose and mouth are the primarily confirmed sources of transmission of the coronavirus. We continue to get reports of people not wearing a mask when they should or wearing their mask incorrectly. This is a cause for concern for all of us. Please, people, please wear your mask properly. We do not want to see a spike in positive cases. We do not want to have to resume hard restrictions, and we do not want more people to be hospitalized or die. Wearing a mask is simple, but it achieves so much. Remember, I wear a mask to protect you, and you wear a mask to protect me. I also want to remind everyone to keep their bubbles small and stay in them. The mixing of households, although it's not prohibited, but it is strongly discouraged. If you cannot avoid mixing households, keep it to a minimum, i.e. a small intimate bubble of family or friends. Whether at home or work, your bubble is not always as small as you may think. You cannot be sure who those people in your bubble have been around. Just switching gears for a moment, we have had quite a few questions about dance schools or dance studios during this phase. So for those persons that are operating a dance school or a dance studio, you can open for business. You must continue to follow the public health guidance for gyms, exercise facilities, and health clubs, as well as dance studios. And this information can all be located on the government website at gov.bm. Dance studios must ensure that each class does not exceed the maximum 10 individuals, to include the students and the instructors. So for example, 8 students and 2 instructors, or 9 students and 1 instructor, but the maximum is 10, including the instructors. They must ensure that all students and instructors wear their face masks into and out of the building during classes and in the hallways and in the stairways. And they must ensure that occupied rooms are well ventilated at all times. It is recommended that all students arrive dressed for their classes if possible, to avoid crowding in the changing rooms. In closing, I want to acknowledge our care home facilities and their dedicated staff. In February of last year, the Bermuda government implemented heightened restrictions for care homes to protect the residents and the staff from COVID-19 virus. The restrictions included physical distancing, twice daily screening for COVID-19 symptoms such as temperature checks, mask, face shield wearing, and increased use of PPE, no visitors to the care homes, no visits outside of the care homes, and monthly COVID testing. Some of these restrictions forced technology changes, with residents quickly adapting to telephone and Zoom visits. These restrictions were intended to keep both residents and staff safe. However, the restrictions contributed to loneliness, helplessness, and boredom in care home residents in some instances. This was an unintended consequence, as care home staff worked tirelessly to enhance the quality of life amongst the residents under their charge. The care homes are to be commended for consistent compliance in response to routine testing, exposure to positive COVID-19 cases, as well as outbreaks. Residents and staff have had to change their way of life inside and outside of the care homes. They have innovatively addressed staff shortages due to quarantine orders, school closures, fear of transmitting COVID-19 viruses to their own families, and shielding the residents. There's some vaccine hesitancy in the care home industry among staff and residents, as there is, of course, elsewhere in our Bermuda community. And we know and understand that the decision to vaccinate is entirely a personal choice. We urge staff to seek credible sources for information about the COVID-19 virus and the vaccine, along with the counsel of their personal physician regarding their concerns in making informed decisions about vaccinations. Care home residents can seek counsel from their care home physician or their own physician and be assessed for vaccine eligibility. We know science has demonstrated that the COVID-19 vaccination may not prevent transmission of the virus in the care homes, but it will reduce the severity of the resultant symptoms. Unfortunately, care homes accounted for 60% of Bermuda's COVID-19 deaths last year and 11% so far this year. I would like to thank our care home residents and staff who have persevered and persevered in the most difficult circumstances over this past year. I thank those who participate in the regular testing needed to ensure early detection of the virus and those who have been vaccinated and now have an added layer of protection for our most vulnerable. Reaching the point of further relaxations requires each of us to do our part in stopping the spread of the coronavirus. Follow public health guidelines, wear a mask, practice good hand hygiene, maintain physical distancing, and download the We Health Bermuda app. Do the research, talk to your doctor, and make an informed decision for yourself about getting the COVID vaccination. Stay safe, Bermuda, and thank you.
Thank you, Minister Wilson, and thank you and your team at the Ministry of Health for your continued hard work and dedication to our country's coronavirus response. Thank you to our teams at vaccination centers, the testing team at Perot, Bull's Head, Pennos, Star of India, our lab teams, doctors, nurses, and hospital staff. I also thank all of those involved in our close to home mobile vaccination initiative, which has helped to make the vaccine even more accessible to those who choose to take it. As the Minister of Health outlined, 65% of our eligible population have now received at least one dose of the vaccine. This means that 2/3 of adults who can be vaccinated have made the choice to do so, including the 868 people who have taken advantage of mobile vaccinations since they began. Thanks to the work of our vaccination teams and the people of Bermuda, the country is now 7th in the world for vaccinations per capita. We are grateful for what we've achieved thus far and that our vaccination numbers will continue to increase and move us closer to our goals of community protection for Bermuda. The government continues to encourage persons to speak to their doctor to find out if a vaccine is medically safe for you and to discuss any questions that you may have. We respect and appreciate that getting vaccinated is a personal choice, and should you decide to do so, we will continue to make it easily accessible for you. Whether you choose to get vaccinated or if you choose not to, we all have a crucial role to play to reach community protection, eliminating local transmission and protecting our country from dangerous variants that can enter through our borders. We have seen a decrease in new and active cases and have successfully moved to phase 2 of our reopening strategy. We have seen local transmission, the 14-day average of our local transmission, drop from 25 cases 2 weeks ago to 6 as of yesterday. However, we are still seeing unlinked cases reported, and therefore we must not allow ourselves to become complacent and delay our move to phase 3, which is envisioned to begin on June 6th. This is an important point. We still have a lot of work to do, and as the Minister of Health said, we are far from out of the woods. Please continue to take advantage of the free testing available to everyone at Pennos Wharf in the east, Star of India in the west, to know your coronavirus status. Download the We Health app, which can alert you to potential exposure, and if used by entire workplaces, can prevent businesses from having to shut down and prevent persons from being able to work. The government will continue to support businesses and persons who are affected by mandatory closures. Persons who cannot work can still apply for the unemployment benefit at uba.gov.bn. I remind businesses who are affected by mandatory closures to go to bdc.bm to apply for the COVID-19 emergency grant for small and medium-sized businesses. The emergency grant helps to cover immediate costs associated with recurring expenses, including rent, utilities, social insurance, and health insurance premiums for employees. As of May 5th, we have implemented stricter rules at our border to protect Bermuda from dangerous variants that exist in other countries. Currently, all non-immunized travelers entering Bermuda will be required to quarantine for 4 days at home or on their tourism property, pending the receipt of their day 4 negative tests. All fully immunized travelers with a negative pretest must quarantine until they receive their arrival tests. Immunized travelers without a pretest must quarantine at home until receiving a negative day 4 test. All arriving travelers will continue to be tested on days 4, day 8, and day 14 following their arrival tests. From June 6, as is previously discussed, mandatory supervised quarantine for all non-immunized travelers will come into effect to strengthen our protection at our border against dangerous variants. Many members of the public have reached out for clarification on who is exempt from supervised quarantine. So I'll reiterate the key points from the Minister of National Security's announcement last week regarding exemptions. As stated last week, the following persons are exempt from mandatory supervised quarantine in a designated facility and are therefore allowed, after applying, if approved, to quarantine at home. Minors age 17 and younger, traveling alone, or parents traveling with a child 4 years or younger. Senior citizens will be able to apply to quarantine at home. Persons who have a medical certificate from their doctors, persons who are certified for essential medical travel, and persons who are considered to be an essential medical companion for persons traveling for medical treatment will be able to apply to quarantine at home. Residents who left Bermuda before May 6 and are unable to meet the requirements to be exempt due to the inability to access vaccination overseas. This, of course, would apply to students or other Bermudians who are residing overseas temporarily, who are returning to Bermuda after June 6 and would have left before and unable to comply. And this is important to note. So students who are unable to access these services overseas, or students will not be required to pay for supervised quarantine, and they can apply to quarantine at home. And a maximum of 2 parents or guardians escorting a minor to an educational institution will be able to apply to quarantine at home, as this travel is considered essential travel akin to accompanying a family member for medical treatment. If you do not fall under these categories and are not fully immunized, you will be subject at this time to mandatory supervised quarantine from June 6 at your expense. What is important is that the cabinet will consider the final conditions, and we will make the final announcements on all matters regarding supervised quarantine and non-supervised quarantine at our press conference on Tuesday, as there are still minor measures of feedback and certain things we want to make sure that we address every concern that is there. The government does realize that not everyone agrees with this policy, but what we can agree on is that we want our schools and businesses to stay open. We want to be able to gather safely with our family and friends, and we want to see an end to all restrictions locally. It is clear that our country, our emotional health, our financial health, and our physical health cannot afford another lockdown. And that is why it is vital for us to take strong actions and protections at our border. To dispel some misinformation that has been spreading, the government of Bermuda has never said that persons who are not vaccinated must have their hotel stay paid for in advance of their departure from the island, or they will not be allowed to leave. This misinformation is dangerous and only sows division at a time this country needs unity. I understand that it makes good marketing for protests, and the lies are effective in getting people riled up, but it is not helpful, as it is false and will cause unnecessary division in our community. What we have said, and what the Minister of National Security said last week, is that persons will be required to prepay for their accommodation, and there will be penalties if the prepayment is not happening. But that is not prior to departure, and it is a key point to note that is prior to return to the island. But as I've said, full details will be outlined by the Minister of National Security when it comes to quarantine facilities and the Minister of Health next week as it comes to exemptions at our press conference next week, Tuesday. We can also agree that we want to save lives and avoid more families from having to mourn the loss of a loved one due to the coronavirus. Protecting ourselves at our borders and keeping dangerous and deadly variants off our shores, of which we have seen the impact of already, can help us to achieve those aims. Unity and togetherness is necessary, and though these decisions are difficult, the government believes that these are the best options and actions that are available to prevent dangerous variants from entering our country, setting us back as we have seen take place in many other countries around the world. I also recognize that there are growing concerns surrounding vaccine status discrimination. And I reiterate that vaccinations are a personal choice. And outside of the protections that are required at the border to keep new dangerous variants out of Bermuda that can lead to another shutdown, there should not be different treatment locally. The government has heard of some reports of businesses who've denied entry based upon vaccination status and will be issuing proper legal guidance to all at Tuesday's press conference. While the government must make difficult decisions in the interests of public health to eliminate local transmission and to protect the country from dangerous variants, we will always support a person's right to choose whether or not they wish to get vaccinated. This includes in the workplace where the law does not allow employers to demand that their employees be vaccinated. However, what is important is that in all workplaces, we want to make sure that there is safety. And so there will be further discussions with employers, et cetera, on how we can make sure that testing can augment any type of safe environment at workplaces, just as what is taking place at the hospital. We are blessed to live in a diverse and free country, a country where each person has a right to express their views, their concerns, and their beliefs. Even when our opinions differ, we must remember that the current battle that we are in is not between one Bermudian and another. The battle is Bermuda united against the coronavirus. And the only way that we can continue to move beyond the pandemic is to work together, unified in our efforts to keep our country moving towards the end of restrictions and back to the normality that we are aiming for. It is this government's honor to serve the people of Bermuda. And I thank you not just for support, not just for cooperation, but for constructively holding this government, your government, accountable. We value your opinions, we hear your concerns, and we will continue to work to address them in this pandemic and also beyond it. I invite you to watch CITV, the Government of Bermuda's Facebook page, or YouTube channel tonight at 8 p.m., where the government's cabinet ministers will be providing an overview of the work taking place within their ministries as we continue to look beyond the pandemic. As I close, I would like to make a correction from last week's press conference. I mentioned receiving a kind and very supportive letter from a 9-year-old Bermudian, which made my day. I mistakenly called them Asia, but their name is Asa Mello. I'm sure he and his family are watching again, so I would like to say to Asa, thank you for your kind letter and the wonderful drawing of this country's flag that was sent as well. Thank you for your comments, and I'm happy to answer any questions that you may have.
Thank you, Premier. At this time, we will begin the question period, starting with Jonathan Bell from the Royal Gazette. Okay, Jonathan, can you hear me?
I can hear you loud and clear. Can you hear and see me?
Yes, we can. You can begin with your 4 questions.
Good evening, folks. Thanks for having us. Yes, Jonathan Bell at the Gazette, Royal Gazette. And that's some good news that we heard about the vaccinations. I believe 44%, 7th in the world. We did want to ask, we're aiming to get to a magic number to achieve community safety through vaccination. Do we really think that we can get to a point where we can drop the physical distancing restrictions and things like that by the end of June? If we don't get to that number, are we stuck with these types of restrictions? We were hoping to find out about that.
Jonathan, I know the CMO is here and he can add more to that, but I think I know that everybody is anxious to see further relaxations. However, I think it's important for us to note that as we continue driving towards our new normal, so to speak, we need to continue with our immunization program, which we are seeing quite successful. If people choose not to get immunized, we need to continue to encourage them to continue testing. Testing is free and readily available throughout the island. So with those two things in tandem, we need to continue to spread the messaging. It is hoped that we will be able to, in short order, reveal certain rollback measures, so to speak, for members of the public who have either tested regularly and or are immunized. And that information will be revealed in the newness of time. I know everybody's waiting with bated breath, and we will be able to present that information. However, insofar as perhaps, and again, I don't want to intercept what the two doctors who are on the call can add, but I'm not sure that we'll ever see a time where we will never, ever have to wear a mask, not anytime soon, but I'll leave it to them, because it is certainly an issue of protection, whether or not it's a situation that we may have to wear them seasonally. I don't think we can say that. I don't think it's time to throw away all the masks, because there may be a time that we will still have to require them, particularly if we're in situations with multitudes of people and the like. But I'll yield to the medical professionals that are also on the Zoom call.
Thank you very much, Minister. I agree with what you've said. That's really helpful. Yeah, I just want to add that in addition to what you've said, the protections at the border, which is the only way the virus can come into the island once we are able to drive the infection rates to zero, is also an important part of our defense against this pandemic, this virus. So absolutely, we encourage everybody to get vaccinated, because there are enough vaccines for everyone who wants to. And the various initiatives we have in place allows us to be able to provide the vaccines, removing the issues of access, allows people to be able to interact directly with trusted professionals who will be able to answer all their questions. So I am more confident than you sound, Jonathan.
Okay, but just to clarify it, if we don't get to that magic number, are we kind of stuck keeping each other to remove, or is, I think maybe the minister was saying it's too early to ask that? You might be clarifying that later.
Yeah, but again, again, as the minister said, it's probably too early, and this is a new virus. We're dealing with something that's we're learning a lot more about this virus as each day goes by. We will be watching this closely and assessing and providing more information and guidance as we go along. But it's important, I must reiterate that there is enough vaccines for people, everyone who wants to get vaccinated. And there's an opportunity for people to ask trusted professionals any questions they may have about this vaccine, and make a decision on whether or not they want to get vaccinated.
Thank you, Doctor.
And can I just add one comment, just to go back to where we were in the when we made the national address. And it's important to remember that what we outlined at that point in time was that our goal is to eliminate local transmission. And I think what you have seen in other countries without vaccinations, even before vaccinations, people were able to eliminate local transmission. That's where we are trying to get to. And I think it's an important point to recognize that.
Thank you, sir. Question number 2, Mr. Premier, might be one for yourself. I was curious to hear, so since our last press conference, looks like we have another legal challenge to the quarantine rule that we discussed this evening. Can you tell us about the legal advice that the government sought before implementing or coming to the decision to secure the borders in that way? Can you tell us about that?
The government will never disclose legal advice that is given to the government. The government is comfortable that the policy that will be implemented will be reasonable as we go forward.
Nothing coming on that one then. Gotcha, sir. Oh yeah, okay. Number 3 here. So the UK government announced its green list, I believe last week, and we are not on that list yet. Is there a benchmark that we have to get to? Can you tell us about how we're going to be able to get our place on the UK's green list? What do we have to do?
That the UK's green list considers a number of factors. Considers vaccination rates, considers that a country such as ours, which is currently in a declaration of a country status of community transmission with the B.1.1.7 variant, with a significant amount of cases of which we have seen recently, is on the amber list. These are real repercussions for our current country status, and the reason why it is important that we take measures to avoid that. So the review will happen every 3 weeks. So it's a conversation with Government House. and we'll see where we are going forward. But we're confident that we continue the trajectory we're in, that case numbers continue to fall, that people do what they need to do to minimize transmission and continue to follow the rules and regulations, then we should be in a good place. And we'll look forward to that review to confirm that we will move to the UK's green list at some point in time in the future. We want to do that. We want to improve our CDC ranking, but it's vital that we continue along the path. And I think that we're moving in the right direction.
So am I doing my math right? That review would be in 2 weeks' time if it was last week that the green list came up?
I think that it was said to me that it's every 3 weeks. So yeah.
I know. The last one that we had, we've heard some discussion about the Pfizer vaccine in 12 to 15-year-old children. Can you tell us where we're at with that discussion with the FCO about amending it, and maybe let us know what the interest has been from parents, the amount of people who signed up to get that shot for their kids?
Actually, Jonathan, the interest has been very good. There are a number of persons that have already registered, quite a number of persons that have already registered their interest for their children. I think many of us within the ministry, myself included, have received calls and emails for persons expressing their interest. The process, as we indicated previously, we are waiting to, and I'll let the CMO speak further to it insofar as the process concerning the United Kingdom, concerning the use of the process that we have to go through, excuse me, Jonathan, so that we can get confirmation that we can use it here. It has been, as you know, approved in the United States, but the CMO will be able to tell you where we are with respect to the process with the UK. Thanks, Jonathan.
Right. Thank you, Minister. Yeah, Jonathan, the issue is about indemnity. At the moment, all the vaccines that are from Pfizer on Ireland are from the UK government, and therefore we're covered by the UK government's indemnity for this vaccination. And UK government's indemnity is based on advice from the Joint Committee on Vaccines and Immunization and the Medical and Health Regulatory Authority, both of which are still considering the data from Pfizer. So as soon as they finish their consideration and they approve this for the 12 to 15-year age group, UK government would approve this, and automatically we would be allowed to use that. But as the ministers mentioned, we're also looking at other possibilities that may allow us to do that faster than what the UK government is doing at the moment.
Thank you, sir.
Thank you, Jonathan. Okay, next up is Trevor Lindsay. From TNN.
Good evening.
Good day, Trevor.
How are you?
You're live and you can start your 4 questions.
Thank you very much for having me. Trevor Lindsay from TNN. I have somewhat of a disclaimer. I would like to say to those, I have many questions that I've received and people are following on social media. I cannot answer all those questions. So Premier, I would ask, would it be possible that these questions can be forwarded to you and sent back so I can post them for my followers to actually know that they're getting their questions answered by you?
All questions from members of the media are able to submit it, Trevor. That thing has not changed, and if they're, that's perfectly fine. But go right on ahead, Trevor. Members of the public can also ask questions by emailing premier@gov.pm, as they do on a daily basis, and they're responded to.
Thank you. In reference to the in light of the legal challenges directed by locals against the vaccination arrivals policy at the airport, are you confident that the government will win the legal battle in this matter?
And, I'm not a lawyer, but what I can say is that the policy of which we're implementing is reasonable. And we are confident that the policy will meet the standards and tests of protecting our borders from dangerous variants, which is the intent of the policy in the midst of a global pandemic.
Since the policy was announced, has there been any adverse impact on our airport arrivals? Those who perhaps have booked and in light of this would not basically want to come? Or do you feel there will be an impact on our tourists coming to Bermuda?
I do not believe there will be an impact on tourism. The government of Bermuda and the Bermuda Tourism Authority has been marketing to vaccinated travelers. We look at our cruise ship policy and the fact that Viking Cruise Lines has added more cruise ships to home port from Bermuda, which the requirement is for those persons who want to go on those cruise vessels to be vaccinated to prevent there from being an outbreak and there to be negative news that happens in Bermuda. So this is a balancing act. So what we're doing is to make sure that we keep dangerous variants out of the country. That is our objective. We have seen what dangerous variants can do, and I do not believe that any of us want to relive the last 2.5 months again. We have lost countless Bermudians, so many. I think today our death toll is up to 32, and before this outbreak it was 12. It is significant. There is a lot of challenges inside of our community. And so what we are making a decision so that we do not have to go back there again. We must do the work to keep out dangerous variants at our borders, and we must do what's necessary to reduce and eliminate local transmission here in Bermuda. The choices are difficult, Trevor. I understand that many people would like us to make different choices. But what I do know is that we believe that these are the best choices in light of the circumstances, and it has been proven to be very effective in other countries who have very tough restrictions at their borders with supervised quarantine to ensure that we do not import new variants.
Thank you. Another question for you, Premier. Because the government has put in place a 3-bid requirement for contracts awards above 100,000, can you, Premier Burt, tell us if CrossInc Limited, who has been hired to collect outstanding land tax, have they obtained a license? And how were they allowed to get a contract without the basis of a license?
That is a matter that can be addressed to the Minister of Finance. I know the Minister of Finance has stated that that matter is currently being reviewed and investigated. And so when the outcome of that is done, we will be able to relay those matters to the public.
My last question. There is another protest rally planned for this weekend on Sunday. Has the organizers been granted a large gathering exemption?
I am uncertain if any exemption has been applied for, and I'm not certain of anything in regards to the permit. Those are questions that could be appropriately directed to the Minister of National Security of the Bermuda Police Service.
Sure. So I have another question, if so. That's what I take it.
That was your final question.
Thank you. That is my final question.
Yes, sir. You had 4 questions.
Thank you, sir.
Thank you. Have a good evening.
Cheers.
Okay, next up is Don Burgess from BDC. All right, Don, you are now live and you have 4 questions.
Good evening. CMO, Bermuda Broadcasting understands a class at East End primaries at home in quarantine already this week. What can you tell us about that situation and how the new protocols went into effect and how effective they were?
Yes, there's been a case in the school in the East End where we found out that the pupil in one of the schools has been positive, and the risk assessments that we have done showed that the school has been actually quite excellent in keeping to the outbreak plan. They have maintained class bubbles, and therefore it means that only small number of children and staff had to be quarantined, and that's what we've always encouraged, and that allows more students to be able to stay in school for longer, to be able to learn face to face. So yeah, that's correct.
Okay, thank you. Also, this is for you. As the new variants of concern spread around the globe, certain stricter countries, particularly those in Asia like Hong Kong, Japan, Korea, and Singapore, and some airlines such as Qatar Airlines, require PCR tests, which have been processed and accredited and certified testing laboratories and healthcare institutions. These countries and airlines are rejecting negative COVID test results from passengers who can't prove that their test was done in an ISO 15189 certified lab. Is the MDL lab here fully ISO 15189 certified? And if the lab is, will you be including this certification information on test results moving forward for travelers?
Don, that's a question for the Bermuda Health Council, not for me. So please direct it to them. They will be able to, they are the ones that accredit labs, and they will be able to answer that question for you. My office doesn't accredit labs.
Okay, so the health minister, would you happen to know the answer to that?
I do not. I know that the Health Council are the regulators and the accreditators of laboratories, and they are the ones that accredit all labs insofar as whether or not MDL is an ISO 15189. I wouldn't have that information, but the Health Council, like I said, are the accreditators of labs.
Okay, thank you. Mr. Premier, tonight you sounded a little bit frustrated about people spreading misinformation, and you said before that you support people's right to protest. But when it comes to reading, spreading dangerous misinformation about COVID, is there anything government or any other local authority can do? In other words, are you okay with zero repercussions for people spreading lies that could put lives at risk?
If there were repercussions for people spreading lies, it would be a very dangerous place. We live in a democratic society, Don. And so the perspective which the government has is the government will continue in all states and all places to make sure that it puts forward the information and the facts. It is difficult. It is difficult to make decisions in a once in a century pandemic. It is difficult to have to make decisions to protect life and limb. We've lost 20 people in this outbreak in this country. 20 people. That's 20 families who no longer have. There's people in workplaces today who are mourning the loss of their colleagues. There are people, although this is real. And so the actions of which we take, we recognize that people may have all types of opinions. But the fact is that this government was elected to lead. We were elected to demonstrate strong leadership, and we are doing what we feel is in the best interest to protect life inside of this country. So the misinformation will continue, and those are people who have ulterior motives. You know, there's people where they have political agendas, where they have other agendas, where they have destabilization agendas, where they just feel like, there's some people who get excited because they get likes on social media and, oh, people see me and all the rest. That's just the nature of the world in which we live in. We are going to continue to put out the facts, and we're going to continue to make the decisions of which we feel are in the best interest of this country. And what we know is that the vast majority of people who have been eligible to receive the vaccine have done so, and we're continuing to increase access. We had 120 vaccinations on our mobile vaccination site today. This worked remarkably well. On your previous question in regards to MDL, the Minister of Health says that Bermuda Health Council is a accrediting body, but let me say this, I have no doubt in the veracity of anything done at our molecular diagnostic laboratory, and it is example to the world, and I am pleased that we have it, because it has saved this country significant money, and it has enabled us to make sure that we deal with the outbreaks in which we face.
Yeah, thank you. Just to follow up with the health minister, the last week we went to 51% from 50% on first doses, and this week it's at 53%. Obviously, at that pace of 3% over 2 weeks, we're not going to hit 70% by the end of the month. Do you have a new target for reaching community immunity?
Don, we will continue to immunize and provide the resources that we need for persons that wish to avail themselves of vaccination, whether it's through walk-ins, whether it's through appointments, whether it's through drive-ins. So we will continue to provide access to immunization for all persons that wish to be immunized. I'll repeat the messaging as it relates to immunization is a choice. and that we would encourage individuals to speak to their doctor and find out what their particular circumstances are and whether or not they wish to be immunized, but they can make an informed choice by looking at credible sources, as well as in particular speaking to their doctor. We will continue to roll out our immunization strategy. We will continue to answer questions that persons may have with respect to vaccination, and we will do our level best and continue to do our level best to make sure that immunization is made available to every member of the public that wishes to take it.
Okay, but you didn't answer my question. Do you have a new target date for 70%?
I do not. At the rate that we're going, you know, we probably increase, I guess, a percentage every couple of days with respect to first dose. And I don't have the statistics from last week, but I think it was, I don't know, 42% of all persons had been immunized, and we're now at 45%. So we're going up several percentages every week.
All right, thank you very
And,
much.
Don, I think what's important to remember, and we want to, I recognize that we want to harp and try to get this. Remember what was said in the national address. Our goal is to eliminate local transmission. Local transmission can be eliminated via community protection. Local transmission can be eliminated by strict restrictions inside the country. Local transmission can be eliminated by both of those aspects. We are trying to get to a place where we have limited local transmission, the elimination of local transmission with strong protections at our borders. So we're going to continue to increase those numbers. But I think what the numbers of which we must be focusing on is the elimination of local transmission, because we must recognize that there are countries who successfully eliminated local transmission and have been able to remove restrictions prior to there being vaccines. So vaccines are a part of them without question. The restrictions are a part of them. The border protection are part of them. And all of those things together can get us to a place where we eliminate local transmission.
All right, thank you very much. Have a good evening.
Thank you, Don. Okay, next up is Earl Basin from Ireland Stats. Hey, Earl, you are live and you have your 4 questions.
Good evening, everyone. Premier, can you explain the difference, please? A local arrives back on the island and tests positive, and they are ordered to stay at a COVID hotel that can cost upward of $3,000. But a local who tests positive before traveling can quarantine at home. What's the difference?
I'm sorry, a local who tests positive before traveling, it wouldn't be.
Well, because you have to get tested before you go, right? Don't you have to do a COVID test before you go?
Earl, I'm not understanding your question. So
Okay, so
repeat it again. I understood, Earl. Slow down a little bit.
yeah.
No need to be antagonistic. I do not understand the question you're asking. So can you please ask the question again?
Okay, all right, okay. So a local arrives back home and gets the test taken at the airport, then comes up positive, and they would have to quarantine at the COVID hotel of choice, right?
Keep going.
Okay, but a local who gets tested prior to traveling and tests positive.
You mean a local test prior to traveling and leaving the country?
Yes.
They wouldn't be able to board the flight. They need a negative test result.
Right, but they quarantine at home. So what's the difference?
We are doing protection of the border. What would be, they would be here. But the protection of the border is to protect against the importation of variants. We know what's here right now. It's not a question of what's on the island. It's a question of what may come into the island. That's the difference, Earl. This is about border protection to prevent the importation of dangerous variants. That is what we discussed at the national address. That is what this policy is about. It is about the reduction of risk of the importation of dangerous variants.
Okay, so a question to that is, can one determine what variants it is when they're tested upon arrival? I'm sorry?
Yes.
Oh, okay. So if it's a local one, they're not required to stay, or they're still required to stay?
What we have at the border is protections for persons who are coming into the country. We understand what we've laid out, and we have laid out the protection for immunized travelers and non-immunized travelers. Those are the rules of which we've laid out.
Earl, just want to point out you have one more question.
All right, that was just the first question. Oh, wow. Okay, all right. Well, obviously, the biggest talk right now, Premier, is obviously the cancellation of the Carifta Games. And a lot of talk is around the comment that was made by yourself in the press conference last week regarding my question and regarding the under 17 division, since which it's now, we hear today it's changed. But there are a lot of people out there saying they feel treated differently when it comes to local sports as opposed to other sports, because this will be the second local sport or second international sport that locals would be involved in that would have to have been canceled or relocated. So how do you calm that talk down?
What was the first? I'm sorry.
Sorry?
What was
The
the
Bermuda
first?
national team having to play their home game away from them.
Ah, yes, absolutely. I mean, the fact is that it's difficult governing a country in a pandemic, but at least I know on May 28th, we'll be able to have a running race here locally. We're going to do things locally. It's a challenge, but when you're dealing with international travel and borders, you deal with the possibility of the importation of dangerous variants. And we have lived the last 2.5 months where we have lost 20 people due to the importation of dangerous variant that has shut our country down. And we don't want to repeat that again. And so we recognize it's difficult. But Earl, what I also want you to recognize is this is a once in a century pandemic. These aren't decisions that we get to make every day. There are no playbooks. There is nothing that is there, but it is a once in a century pandemic. So from the perspective which we had, it is unfortunate. Would I want for it to happen? Absolutely. Absolutely. The government supported it. The government put money towards it. This is something that absolutely wanted to happen and we were looking forward to. We did not expect to be here. The issue of the arising of new variants and the need to protect ourselves from going through what we went through this past 2.5 months is necessary. And so from that perspective, we have to make the decisions on a broad basis and levels. And it's important to know, we did not cancel Carifta. We have our rules which are laid out. We did not cancel Carifta. The rules that were laid out are there. And we tried to work with the persons to talk about the fact that there were no hotel rooms available. That's nonsense. That is not correct. And I know that those things were clarified. So it is a difficult situation, but I'm quite certain that the Minister of Sport, if they haven't already spoken to you, will be happy to give you an interview and to walk through all the specifics around it. I am incredibly disappointed. I would love for Carifta to happen. But what I do know is that on May 28th, we'll have a running race for Bermuda. We'll have a cycle race for Bermuda, and we will continue to do what is necessary to promote local sports. We're working to get local sports up and running, and the Minister of Sport is doing that, and we're going to continue to do what is necessary here. Our protections are to protect the importation of new dangerous variants at the border, and it is the right policy for the governor of Bermuda to adopt.
But the mere fact, Premier, and I heard everything you said, and I agree, but we hosted an international sporting event without Bermudians involved during our worst month.
When was our worst month?
April.
Okay. Before border protections were put into place, Earl. So we can go back over that a million times.
Right.
We now have border protections that are in place. We had a situation, we've adjusted to the situation, and we're moving forward with the adjustment of which we had. We have increased protection of the borders because we are dealing with new and dangerous variants. Unless you want us to just leave the borders open until after Carifta, and then hopefully that we will have, hopefully we'll avoid a new variant, that's fine. But Earl, unfortunately, you, or fortunately for some, you don't get to set the policy of the governor of Bermuda. It is easy to sit back at that stage, but it is difficult to make the decisions, especially when you're dealing with the loss of people that are close to you. So the perspective that the governor of Bermuda has is to work to protect life in this country, to work to make sure that our schools remain open, to work to make sure that entrepreneurs can continue, and to work to ensure that we have the conditions so that local sports in this country can happen. And that is what our policy will yield. And we support and recognize that we have to move forward. And I'm gratified that a vast majority of the population supports the measures of which have been put in place. Thank you.
All right, thank you, Earl.
Okay.
Hey, Premier, that was the final number of questions from the media.
Oh, thank you. Okay. Thank you very much, members of the media, for your questions on behalf of people of Bermuda. Thank you, members, for tuning in, members of the public for tuning in. As a reminder, at 8 p.m., please tune in to CITV or the Governor of Bermuda's social media properties to hear a message from the hardworking ministers of this government who have been working since October 1st to deliver for the promises for the people of Bermuda, while also making sure that we do what is necessary to move Bermuda beyond the pandemic. We'll be back with you again next week, Tuesday. With that, thank you, Bermuda, and good